Hi, I'm Ed Levin, director of the Duke Center on Addiction and Behavior Change, part of DIBS. And I welcome you to our seminar series. We are, before I introduce today's speaker, I just want to give you a heads up as far as what's coming up for the rest of the semester. Next week, we're going to have Alex Marshall, who's a faculty member at NC Central University, our sister university here in Durham, and he's going to be talking about neuroimmune response as a mediator and consequence of alcohol abuse. And he's part of a big center grant there and at UNC and here at Duke on adolescent alcohol abuse and its mechanisms and treatment. And Andrew Hockey from Duke, actually I collaborate with Andrew, is going to be giving a talk about smoking risks in pregnancy, beyond nicotine, all of the other components of tobacco that cause health risks during development. And then finally, we're going to end up on December 8th with Connor O'Neill speaking to us about evidence-based treatment co-occurring substance use in adolescents and young adults. Now, we have the seminar series fairly well set for next semester. We're going to be starting with Linda Perino from Wake Forest University on January 19th, the consequences of chronic drug abuse, reflections on a career in translational neuroscience. And then importantly, we're going to have later in January, TROSA, this very, very successful residential treatment program here in Durham with people who are participating in that program to give us an idea about the real life experience of these people and their road to recovery. And then we're going to continue on through the semester. I want to highlight the symposium we're going to have Together for Resilient Youth, a community group run by Dr. Wanda Boone here in Durham on marijuana legalization, brain science, community impact, and risk prevention. So that'll be on February 22nd. And the registration information, I believe, is in the chat. Yeah. So Tyler's listed in the chat. Also available on the CABC website and on the DIBS site. So please go ahead and register for that. And so it's free, but we just need to have an idea of how many people are going to be coming. So today, it's my privilege to introduce Jason Sharpe and Chris Stark from here at Duke, and they're going to be talking about their approach to dealing with possible drug misuse among Duke students in the system called the Impact Feedback and Evidence-Based Personalized Feedback Reporting System. And they're part of the Do Well program here at Duke University. And so they're going to speak to us today about Duke social culture and substance misuse prevention. Justin.
Thank you, Ed. Good afternoon, everyone. Thanks for being here. We really appreciate it. Like Ed mentioned, my name is Justin Sharpe, and I serve as the Associate Director in the Student Wellness Center at Duke University, where my primary responsibilities are overseeing the alcohol and other drug misuse prevention and intervention services. And I'll toss it over to Chris so he can introduce himself.
Yeah, my name is Chris Stark, and I'm at Western Washington University. My position there is in the Office of Survey Research currently, and I also am the president of First Light Web Services, and we provide the software that Do Well uses for basics and for this new student orientation.
Perfect, thank you. So just to give you a rundown of the agenda and kind of the format of our presentation today, feel free to pop any questions that you have as we're going through into the chat, or feel free to hold those to the end of the session. We're happy to hold a couple of minutes at the end to answer any questions or to solicit feedback from experts in the field, which is on the screen with us right now. And you all are able to see my presentation, correct? Okay, good deal. It's not showing me my typical green box of that is being shared. So thanks for the thumbs up. So for this particular presentation, we're going to give an overview of what the institutional setting is, knowing that the majority of you are coming from Duke, but what our target population is right now, and current trends we're seeing based on a couple of different data points that we track over the past decade and throughout each of the semesters to make sure that we're doing our due diligence when it comes to preventing substance misuse on campus amongst our undergraduate and graduate students. We're going to go over a little bit about building the Wellness at Duke module as a prevention method to kind of counteract or kind of increase knowledge and understanding as it relates to our high-risk populations that we typically see on campus, and alleviating some of those incidence rates as it relates to assessments and transports. Chris will talk a little bit about leveraging basics as an intervention program, as well as how we've started to use it as an evidence-informed prevention program. And then next steps, just kind of letting you know where our next steps are in relation to this particular program, and where we're hoping to take it at the intersection of both wellness and preventing high-risk behaviors on our campus. So institutional setting and current trends to start out there. So most of you, if you're not familiar with the Duke, four-year private research institution, our undergraduate enrollment in for the class is about 6,500 students, 1,700 of those being first-year students. And if you're not familiar, there is a 3-year live-on requirement for our students. Alcohol is not permitted on the first-year residential campus, but Duke in itself is a wet campus, quote-unquote wet campus, for those living on the upper class or west campus. So this data that you're seeing on the screen here is showcasing the National Collegiate Health Assessment data that we collect every other year, with a sample of students that are invited by our assessment group on campus. So the end of this particular survey was about 897. And this includes both students from the undergraduate class, as well as a graduate professional student class. So you can see kind of in hierarchical form here what typically and what substances we are seeing on campus and where a lot of our efforts go as it relates to preventing the misuse of these substances. So alcohol definitely being number one, followed by cannabis, e-cigs, hallucinogens, cocaine, inhalants, prescription stimulants, and sedatives, with the last two being using those prescription drugs without a prescription or using them for recreational purposes alone. So to dive in a little bit deeper about the alcohol piece, so out of this particular survey, we typically see around 80% of our students that are coming to Duke, both from the undergraduate and the graduate side of things, that are doing so if they are choosing to drink in a very low risk or moderate manner, where 82% of those individuals that have taken this survey typically drink less than 4 drinks or fewer each and every time that they are consuming. One second, sorry about that. So that leaves about 20% of our population that are experiencing high risk or higher risk behaviors associated with that, which is consuming either from a frequency or a quantity standpoint. So the next couple of data sets is a huge piece that we've tracked over the last couple of years, all the way back to 2014, to show where our prevention efforts are coming and where our targeted efforts need to be for each upcoming year. So what you're seeing on the screen right now is the number of students transported by year. And this is primarily focusing on, or a large number of this, are our undergraduate population. So you can see by each year, the number of transported students by EMS. This means that they were assessed by emergency medical services and they were transported to the ER for alcohol-related incidences, primarily alcohol poisoning and or other injuries related to an alcohol drinking episode. Also with the caveat, thinking about 2020 to 2021, that was our year of COVID, where we only had sophomores and first-year students on campus, but juniors and seniors, if they elected to come to Durham, they had to live off campus. So COVID being a really good environmental prevention strategy as it relates to substance use, to show that the numbers and kind of an environmental prevention strategy works. And then where we are right now in July to September, our numbers being at 19 for those transported. Now we're looking at the percentage of transported class or number of students by class year. So you can see disproportionately the number of first-year students are transported at higher rates, which goes along with current research and current literature amongst the first-year students. So thinking about student developmental abilities as they either learn from past mistakes, learn where their quote-unquote limits are as it relates to alcohol, as they progress throughout the rest of the remaining time of their undergraduate career at Duke. So really targeting those first year students, and that's kind of building up the piece of what we need to do and what we have done as it relates to a prevention method amongst our first year students. The next kind of data set that you're looking at right here is now looking at these number of transported students by month. So all the way again back to 2014, 2015, all the way to this current academic year. And there are trends that we can typically see through this way of a line graph of pockets of about 4 different sections of this graph where we really hone in our prevention efforts. So this first cluster right here is the first 6 weeks of the academic semester. There's a lot of social culture that drives parties, off-campus parties, drinking amongst the first couple of weeks, kind of getting back after a long break of the summer, getting back with friends. So large opportunity within that first 6 weeks of class and prior to their arrival at Duke to increase knowledge and awareness and understanding to hopefully influence behavior change through a harm reduction approach. The next kind of cluster and grouping, we typically see first midterm complete, pre or returning from fall break, and then Halloween, which we just had Halloween this past weekend. And I can say to this group that we had no EMS assessments or transports over Halloween this year, which is probably one of the first in many years that we have seen that. Then we have in January, which will be changing this year. So rush and recruitment in the past couple of years have typically happened amongst our first year students where they are joining social fraternities and social sororities or selective living groups on campus where alcohol is typically present at those rush and recruitment activities. As of spring 2021, so this past spring, Duke administration within student affairs changed the kind of policy around that to where rush and recruitment does not happen for our first year students, but only happens for sophomores and up. And we do have a little bit of a caveat right now too. So we do have about 7 interfraternity council organizations that have disaffiliated from Duke that are no longer recognized by the institution as being a fraternity or sorority, but they are recognized by their national or international headquarters, and they may still be recruiting first year students. So we're trying to navigate and see what might happen off campus from an environmental standpoint when it comes January and February. And then the last one, so unique to Duke, the last day of classes, or LDOC is the tradition, the last day of classes, which has been a huge environmental culture shift over the past couple of years, especially with the inception of this office that I work for. My director, Tom Zigathy, who was brought on to help kind of shift the alcohol culture around LDOC, has definitely done that, where we do a lot of prevention and environmental strategies and work with a wide variety of stakeholders and campus partners across the institution to make sure that that is a safe environment. So a lot of opportunities for prevention, 4 different touch points. And for this particular presentation, we're going to be focusing on that pre-arrival to campus with amongst our first year students and what we have done to build up a personalized feedback report, as well as leveraging harm reduction strategies being built if they're choosing to drink prior to coming to campus. And I'm going to toss it over to Chris to kind of give a background around basics and kind of go into how we've used basics as an early intervention piece, as well as now as a prevention piece.
Thanks, Justin. Basics is a alcohol intervention that's used for college students. And I'll go into more detail about what basics is in just a minute. But in short, it's typically used at college campuses for students that have been mandated to go through the program because they got into some sort of trouble regarding alcohol. They could have gotten caught with alcohol in their dorm room or been a medical transport, and then they're mandated to go through the basics program. It's used by hundreds of universities across the country, and Duke has been using it successfully for a number of years. I've been working with folks there for 10 years, so it's been going on at least 10 years there successfully at Duke. So what we wanted to do is take some of the features of that basics program and then leverage it for the incoming students. So we wanted to apply what we know about basics and then target it for those incoming students. So that's what we mean when we're leveraging basics. I'm going to go to the next slide, Justin. So basics, you can see the acronym there. It's a nationally recognized program. It was originally created at the University of Washington by Dr. Alan Marlatt at the Addictive Behaviors Research Center. At the time in the 1980s, really the only alcohol program that universities were using was a 12-step program. So if students got in trouble for drinking on campus, they were sent to Alcoholics Anonymous. And what researchers were finding is that it wasn't having much of an impact on the students. It was pretty unsuccessful. So Dr. Marlatt set out to create this new program that was focused on reducing the harms associated with alcohol. And it was really a non-judgmental approach, a different approach to handling these college students. And what they found is a lot of research has been done on this program. It's become kind of the gold standard. It reduces some of the negative effects that are a result of alcohol use. It also just reduces the amount that students drink, and it provides important tools, coping strategies for the students so they can help reduce their risks. And kind of the model for basics is students meet with a provider on 2 different occasions. After the first meeting, or during that first meeting, it's largely focused on alcohol information and education, how alcohol is processed in the body, how much alcohol is in a standard drink. So a lot of alcohol information and kind of a rapport building session. And then that's followed by the student taking an alcohol assessment, where we measure all sorts of things like how frequently they drink, how much they drink on a typical occasion, some of the negative consequences they've experienced. And then that alcohol assessment, we calculate a whole bunch of things like blood alcohol content. Then 2 weeks later, the student meets with a counselor and reviews what we call a personalized feedback report. And that personalized feedback report translates the answers from the alcohol assessment into a graphic feedback report that it shows a number of things. One is we compare, using the National College Health Assessment that Justin mentioned earlier, we compare the particular student's drinking to their peers. So we look at this student's frequency of use or quantity of use and compare it to the normative data at Duke. And I think Justin has some charts he'll show you in a minute that show you how we do that. So the basic model there is 2 sessions. They take an alcohol assessment after the first session. 2 weeks later, they review the personalized feedback report with the provider. I want to go to that, yeah. So for the past few years, we've applied kind of this basics assessment and feedback report model to the incoming students at Duke. It's been modified a little bit from what we do with the mandated students. But Justin approached me about a year ago and said, we'd like to make this more of an overall wellness module. So he asked if there was anything out there that we had built that looked at well-being of the students overall. And I said, indeed, yes, we do have some information like that, and we can use it for your incoming students. Yeah, you can go to the next slide, Justin. So just a little bit of information on the impact feedback software. It's a case management software program that we built for basics. But what we found over the years is that the machinery that we built to do basics well lends itself to doing all sorts of other things. So the software comes with a complete survey design tool. So a lot of folks will start off with one of our survey templates, but they could create their own surveys from scratch if they like, or edit existing templates. So the survey designer is similar to, say, Qualtrics or something like that, where you can build whatever survey you like, or edit existing surveys. And then an important kind of second piece that we have is a report designer. So these personalized feedback reports, we can completely tailor those for each university, rearrange order, delete items, add items. So the report designer is kind of a key piece there too. We can, in this case, add wellness stuff to the existing basics report, feedback report. And then a couple other aspects that I think are important. So we can design these really complex process flows based on the characteristics of the student. So if a student's added to the system and they're here to do basics, then they're going to be routed through this process flow where they schedule an appointment with a counselor and so on. But in this case, for the incoming students, we want them to take this well-being module and then see their feedback report. And then the last part I wanted to point out is that there are 70+ universities that use Impact. And what we find is that we do a lot of collaboration with different universities. So if a university on one campus builds a assessment for nicotine cessation and a feedback report, then we can share that with other universities that use the system. And so that's what we did in this case with the well-being piece for Duke. So the Duke wellness module that we use for these incoming students, the wellness content, we got that from the University of Massachusetts. So I've been working with folks there for probably 20 years, and largely they do basics, but they've kind of evolved into some other programs. And they developed this well-being module that looked at different dimensions of well-being for the student. So the student takes an assessment, and it's looking at things like spiritual, financial, academic well-being, and then provides a feedback report to the student, showing them kind of how they rate on these things, and then provides feedback and information kind of based on where they score on those dimensions. And so this well-being module, using that kind of basics model of assessment and feedback. So take the assessment and then are presented with a feedback report. And then we customize both the alcohol pieces and the well-being pieces specifically for the Duke orientation. And then briefly, the process flow for the first year students was that we imported into Impact all the incoming students. So an Excel spreadsheet or a CSV file, imported their information into Impact. And then that resulted in an automatic survey invitation to these students. And they click on the link, take the alcohol assessment or the well-being module. And then immediately upon finishing the well-being module, they're presented with a link where they can click on that and then view their personalized feedback report. Additionally, we set up like an automatic notification that sends them a link to the feedback report so they have it for later use. We also, and the last thing there, we also incorporated some notifications. So based on the assessment results, if students indicated some form of high risk, then we set an automatic notification to go to the Do Well email and let them know there. And I think Justin has access to that email. Let them know there, hey, this student might be a high risk case and we might want to follow up. So I'll turn it back over to Justin, and I think he'll go into more detail about the content of that wellness module.
Thanks, Chris. So kind of piggybacking off what Chris was saying with how we developed this and some of the reasons why. So prior to 2019, we were using a program called Alcohol EDU for all of our incoming students. And we did some transitioning with some changes in leadership and really wanted something that was able to be tailored specifically to Duke. And that's where we were able to really lean into a program that we had already been using for 10 years, as Chris mentioned, to really tailor it specific to Duke and our students needs, and meeting them exactly where they are and where they will be or could be, and utilizing this in the personalized feedback report. So I've been at Duke for almost 5 years now, and while I've been a basics facilitator in this kind of role, getting some qualitative feedback, some kind of using focus groups, and just learning and hearing some of those students that Chris mentioned that are being sanctioned to come through our office as that early intervention piece, hearing the same stories over and over again about what they're missing or what education or knowledge that they did not receive from particular programs, and how can we use those bits and pieces of information that they're learning in basics and putting them at the very beginning of their time prior to their arrival on campus. So for this particular session, the way that we have it set up every single incoming and transfer student amongst the undergraduate class. And we've also incorporated our DKU students into this as well, because we are now kind of in that modality of welcoming 300 DKU students each semester as well. So encapsulating about 2,000 students that go through this module. They have the opportunity to complete the module during the summer. So the invitation, which you're seeing on the screen right now, goes out July 1. And then they have about 30 days to complete that entire module prior to their orientation on Duke's campus, which typically happens between the first and second weeks of August as a week-long orientation. So the part one of the wellness module is what Chris was really talking about, that survey, that assessment, and giving them the personalized feedback report. And then there's also a part two that we developed, and I'll just talk about it briefly, where we go through kind of as a universal approach, go through the feedback report with them, very similar to what we would do in an individual session with those students who would have been sanctioned to come through basics, to kind of walk through some information, what the graphs are telling them, what the different charts are telling them, and then allowing them to come up with their own conclusions and letting them know what harm reduction plans or pieces have worked for our students in the past, and scenarios of where they might be faced with of what they can do to make better choices or better decisions if they are choosing to consume. One of the things that we have seen and kind of tracked over the last couple of years, there's on average, about 60% of our incoming first year class that does not use or has never used alcohol or any other substances prior to their arrival at Duke. So because of this particular statistic, we wanted to make sure that we incorporated at least scenario-based questions and plausible, like if this, then this. So Chris and his team were able to create kind of a scenario-based question to where it was taking their demographic information, sex assigned at birth, and weight, and they were able to put in, if they drink this amount of drinks in this frequency of time or this period of time, this is what the output of a particular blood alcohol concentration would be for that particular student, because they weren't drinking and they have never experienced any type of alcohol or substance use prior to their arrival to campus. So they get sent the email, and again, an automated messaging system there, as well as follow up if they haven't completed. And then we're getting into this personalized feedback report. So the first two kind of images that you're seeing on your screen, I know it's quite a bit of information, but just to kind of give a summation of this is the part where we tailored our approach from the Umass Amherst Wellbeing Survey. So wellness and well-being definitely having an intersection with substance use, substance misuse. We wanted to see where they are evaluating themselves as it relates to the wellness dimensions that we observe here at Duke. So those bar graphs that you're seeing right there are our 6 dimensions of wellness that pertain to our framework of how we define wellness for our undergrad and graduate students at Duke. It kind of incorporates a model and a program that we have in person as well, where we do a little bit of group health coaching, where students are able to pinpoint where their strengths are, as well as where there's opportunities for growth as it relates to each of these dimensions of wellness. And then it gives either a strength or an opportunity for growth. And based on where they fall within the bar graph of the level of satisfaction, we're able to provide them with strategic resources that can help them elevate that particular piece of wellness once they arrive at Duke. So increasing those resource-seeking behaviors and allowing them to kind of get a foundational aspect of what resources they do have available on campus that can help them elevate their own well-being. Built into the survey, there's another well-being scale. So the Warwick Edinburgh mental well-being scale is also used to measure emotional wellness. So we know just kind of from a research standpoint and kind of the trajectory of where a lot of this research is going, it's leading into emotional wellness as we get into mental health concerns and looking and seeing what strengths they have in their emotional well-being and where their opportunities of growth lie there as well. And then kind of transitioning into the substance use piece, the graphs that you're looking right here is referencing to what Chris mentioned previously, where it measures frequency and quantity of alcohol use on the left-hand side, and then the frequency of cannabis use in comparison to their peers at Duke based upon the National Collegiate Health Assessment data. So it's getting into that norm, the social norming, showing what percentile they fall in comparison to their peers. And the way that we use this particular graph is to show them where they are and to see if there's any movement of reducing based on frequency and quantity. So again, asking those open-ended questions through a motivational interviewing aspect to see if whatever happened or what has the potential to happen, how can we use a harm reduction approach to get them on a safer side of use if there are high-risk use there. And what Chris was mentioning too previously, so we do have a flagging system that alerts us to high-risk alcohol use, which allows us to interact with those high-risk students earlier in the event, where they can come in and have a conversation with us because they may have been drinking prior to Duke. So we're setting them up with support prior to them getting in trouble on campus. Same with those individuals that are identifying in recovery or having or being in long-term recovery or an active substance use disorder, asking those questions so they can get pulled into our collegiate recovery community early on as well, and setting up that support system. The next couple of slides or images looks at blood alcohol concentration. So looking at a peak and a typical based in the last 30 days, really emphasizing what a typical looks like if it is on the lower side. And again, this is just an example of what we typically see of the number of drinks and the number of hours, and then what a blood alcohol concentration based on their demographic information would be present. The biphasic effect, the graph that you see on the far right, is really something that we've turned into a social marketing campaign where we talk about Ride the Wave. So you see our little graph or infographic graphic that we use for Ride the Wave. And that's something that our students have started to make a joke about, but I'm okay with them making a joke about because it means that they have retained that information and use that information of what we say of riding the wave to keep themselves in that buzz zone where all the euphoric pieces can happen with this and the socialization that typically happens with alcohol without getting into those higher BACs where we typically see a lot of that high risk behavior. So we've kind of defined Ride the Wave for most people being about 1 or 2 drinks in the first hour, no more than 1 drink per hour after that, with a max of 3 drinks total for the entire drinking event to keep yourself in that low risk zone as much as possible. Then we connect that to their BAC card. So it is able to pull, again, demographic information, so sex assigned at birth, weight, and we connect this to their Ride the Wave graph, or the graph of the Ride the Wave, the biphasic effect, as being the line in between the green and the yellow zone is that peak euphoric Ride the Wave zone. And we're wanting them to look at this particular graph and to be able to go ahead and set a drink limit for themselves that will keep them on this path of Ride the Wave, of looking at the combination of drinks and hours that will keep them being able to do so. We also go over sizes of standard drinks as it pertains to beer, wine, liquor, seltzers now, incorporating as much anecdotal information of what we're seeing from previous years into these modules to make sure that they're getting relevant information. The next graph talking about sobering up, again, based on their peak and typical BAC, a lot of inconsistencies and myths associated with sobering up about drinking coffee, exercising, eating greasy foods, but letting them know that time is the only thing that sobers an individual up. And that last bit of information at the very bottom, taking again some demographic information and really using the calculations that go into the BAC card for each individual student to know how long a standard drink for them specifically will leave their body. So for this particular example, being 1 hour and 34 minutes to leave the body at a rate of 0.015% on average. Next, we talk about alcohol's effect on sleep. This is where we introduce terms like blacking out and browning out and why those instances occur, thinking about the hippocampus and the conversion from short-term memories to long-term memories, and how this particular setting can impact academic performance, kind of getting into misremembering or not remembering things that you need to commit to long-term memory as it relates to your studies. And then last but not least, it talks about their risk for a potential substance use disorder based on the audit and genetic predisposition on that end. Then it gets into thinking about the motivation, the confidence of where they feel they are right now in their choices or their use with substance use, and where they might want to go. So we're thinking about the stages of change theory, looking to see where they are within pre-contemplation, contemplation, action, or maintenance, to try to figure out, is there any movement that we can do right now as it comes to their substance use to make better choices or to lessen the severity or the potential of high-risk behaviors from occurring. And then the last one, they're able to choose harm reduction strategies that they think might be beneficial for them. So you can kind of see, as it's broken up in that bottom right-hand image, that they don't drink, but they understand the benefit of these strategies, that there's strategies that they're doing right now, something that they're considering doing, and then something that they're not interested in doing right now. And when it comes to these, again, from the motivational aspect, we're looking to see from those right-hand side, what can we do to move it down at least one column, maybe into the doing now, to have them think a little bit more of why this might be a good idea, of the knowledge and understanding and translating to a behavior change once they get on campus. So once they figured and completed all of the personalized feedback reporting pieces, they, like I mentioned, they receive a link to that. They're able to download it into a PDF and refer back to any of the information that was presented, the resources, the BAC card. And then they use that information in part 2 of the wellness module, which we build in Sakai, where a lot of those kind of interactive conversations and the assessment happens within Sakai, where we have videos, questions, both qualitative and quantitative assessments, to kind of really feel how much did they learn and how much could they apply in scenario based as it relates to part 2 there. All right. Chris, anything that I missed as we were going through, or anything that I left out that we might want to highlight?
Nothing comes to mind.
Okay, perfect. Yeah, so, and now in thinking about next steps, so we have our first full cohort that just went through this particular Wellness at Duke module, both from a well-being standpoint, as well as a substance risk or substance misuse prevention standpoint. So there's a lot of really good data points connecting both to resiliency, connecting to emotional well-being. I have not had the time thus far in this semester to delineate or kind of analyze any of the data that we have. It's been an interesting semester welcoming all of our students back to campus post-COVID, but looking to see what data points we typically see as it relates to our assessments and transports of our high-risk drinkers. But even anecdotally, of the 99 referrals to basics that we have had thus far this semester, students are able to tell me where they went wrong in their harm reduction plan. They're able to tell me what the definition of ride the wave is, which prior to this year was not happening. So it's already getting to think, again, prior to coming in, what they can do next time to help them prevent any of these behaviors from occurring again, which is really cool. But I'll open it up for questions at this time. Would love to hear feedback. Chris and I are in the process of developing a presentation for our NASPA Strategies Conference that happens in January, which will be commenting on this. And I'm also considering this becoming a part of my dissertation work. So would be happy to hear any suggestions as it relates to turning this into an evidence-based, or at least an evidence-informed program for our students here at Duke. But yeah, we'll open it for questions.
Well, thank you, Justin and Chris, for a great program, and it looks like it's having very good impacts. And so if anyone has questions or comments, now's the time you can just speak up.
Yeah, hi, and Chris and Justin, my name is Jeff George. I am a clinician, and so I'm coming at this from the other end, kids at Duke who already have a substance use disorder, who have developed it pre-Duke or during at Duke. And it's interesting that there, and again, this is a subjective and a very small end, but their report about the amount of alcohol on East Campus is pretty impressive. My office is one block off East, and I didn't go for the last 2 years because of COVID. But prior to that, I would often go over to East Campus on weekends, and the amount of alcohol open use is remarkable. Two of the three people I've got in treatment right now as undergraduates are supposedly in the alcohol-free or drug-free dorm. That is a dangerous concept because parents think that they actually mean it, but according to these students, they can openly move in and out of that dorm with alcohol and marijuana visibly and have no problem whatsoever. And in terms of the levels of use, I would recommend anybody that has a free weekend to spend some time at Shooters. It will give you an eye-opening view of what a lot of Duke undergraduates are doing. And then I guess the last thing is there is a disconnect between the prevention efforts and the recovery options available to kids who really do have potentially dangerous substance use disorders. And again, subjectively from the students that I am working with, they see very, very little, if any, support for their recovery options. And so there's a disconnect, and I don't know how to bridge that. I would be happy to meet with you guys at some point. I've been associated with Duke since the 1960s when I was an undergraduate. My daughter was here in the 90s, and I've been faculty on and off the entire adult life. It hasn't changed much over those 50 years, and there's a concern that somehow we're not reaching some of these at-risk students, and they're flying under the radar, even though you're working hard to identify them. So I'm going based only on that treatment view, and it's not pretty.
No, I appreciate that view, because that's obviously a view that I don't have from the treatment side of things. And before the grouping that's on here right now came on, we were talking with Ed a little bit about what the treatment on the side of things looks like at Duke. And currently there's no individuals within our counseling and psychological services that have a specialization like an LCAS on addiction. So most of our students, and you being one of the referrals, obviously, of seeing those students, we typically refer to those to Connor O'Neill in the CAS program, or offering that up if we are seeing any high risk concerns through our early intervention pieces with basics. As it pertains to the recovery support, this is something that Tom Zigathy, I don't know if you're familiar with him, so he's my director within DUL. Over the past 5 years that I've been here, and I know he's been here for 13, 14 years now, the Collegiate Recovery Support Group that we have, it ebbs and flows with the number of students that come in. Primarily, we typically only see graduate students joining that support group. And out of this first year class that we have right now, including that question on the assessment of if you are in recovery or long-term recovery or in an active substance use disorder, we had about 10 or 12 students indicate that yes, that they were. And so we automatically try to plug those students into our recovery support systems or trying to get them into treatment locally as best as possible. But I mean, we're definitely missing some opportunities there for marketing and a lot of turnover with that group as well, just because depending on the grad programs, typically we see those coming from Fuqua and law. So those are only 1, 2, 3 year programs and really trying to keep up with the sustainability efforts there. So we definitely understand and see that there's a need for the recovery support pieces. And then to talk about the drug-free dorm. This is the first I've heard about that. I don't work in housing and residence life. So they're the ones that oversee Jarvis on East Campus with that substance-free dorm. And I will bring this up to the Dean of Residence Life on East Campus just to see if there's any opportunities for conversation to happen, primarily with what you were seeing or saying about the dangerous, that it's dangerous for them, that there is a free flow back and forth of just substance use being able to happen, to see what we can change or kind of to help out with ensuring that is substance free, because I mean, definitely impacting our students on so many levels if they're seeing that being used and they are in recovery. So I appreciate that.
And I think you might touch base with Dean Blackburn at UNC. Their program seems to be working a little bit more effectively in terms of actually connecting with the community and students. So it's just a thought. And I'm concerned about, as I said, the disconnect, but I am very aware that I'm seeing it from the extreme other end. Students who have been sent here to either with me, from their parents, or from having some pretty significant substance use disorder identified somewhere. And so these are not, quote unquote, the average Duke student by any means, but they're still important.
Oh, definitely, for sure. Completely agree. Thank you. And yes, I will definitely take your name down, because there's some other conversations that I would love to have and follow up with that as well. So we can kind of use your expertise and what you're seeing as assessment data to help us on our prevention side of things as well.
Super.
Thank you so much.
Well, thanks, Jeff. Are there other comments or questions? Yeah.
Yeah, I'll speak from the more normative side. I teach a freshman seminar on drug addiction, and we have a conversation every year about the alcohol culture that they've experienced so far. We just did it at the end of October. And all of my students loved the basics questionnaire coming in and how it was personalized for them. So thumbs up, definitely keep up the good work on that. Another interesting conversation that I had with them was about the party culture and how, because I knew there was a large percentage of students who didn't drink. And I said, how can the people who do want to drink support and include those who don't, and vice versa? And so it was a really robust conversation around that. And the takeaway that I got was that there's sort of two parties. Like, if you want to go to a drinking party, you go to a drinking party. If you don't, then you do other things with non-drinking friends. So that was a little bit worrisome, but I was really assured that they said, if you go to a drinking party and then don't want to drink that much, there's not much pressure there. So I think you guys, this is another piece of evidence that you guys are doing a good job on normalizing healthy, low risk drinking. So I don't really have a question, but I just want to give you what I'm seeing from my freshman seminar, that there's always work to be done. There's always more to do, but I'm seeing a lot of good work so far.
Thank you. Yeah, I appreciate that. And it kind of reminds me, I went into Dr. Rezvani's class a couple of weeks ago and talked with his group. And we did a little bit of focus group of like perceptions and norms associated with the culture that Duke has prior to their arrival on campus, which you all probably have heard, the work hard, play hard mentality. And I asked them, I'm like, where did you first hear that? And what do you define as playing hard being? So it was kind of twofold. Some of them definitely said that the social culture of play hard definitely included a lot of substances, and being that their coping mechanism for releasing stress on the weekends. And it just dawned on me as I was talking to one of our wellness interns that this past year's class in particular, they did not have the opportunity to visit Duke in person. So they were watching YouTube videos. And this one particular YouTube video, it's a woman who does 72 questions on a variety of campuses and is asking a current student on that campus different questions. And within the first 3 minutes of this particular YouTube video that had, 80,000 views, she said, the woman in the video, work hard, play hard 3 times within the first 2 to 3 minutes. So already ingraining this possibility of a self-fulfilling prophecy that this is what Duke is supposed to be like. this is why I might have chosen Duke, because then they talked a little bit about U Chicago, where their tagline is where fun goes to die. And that's like, well, the other end of the spectrum is work hard, play hard. That sounds a little bit better. So looking even on that space of the culture and the environment that exists, that is so hard to change. Like, I mean, we could probably go delete the YouTube video, but that's not something that's realistic. But I do appreciate that and the feedback for sure. And that's something that the entire kind of student affairs into the institution is starting to change. You probably all have been at least briefed or at least told of the new residential model that's happening with Quad X. It'll be interesting, kind of a social situation, social experiment, how that helps. The pre-orientation programs are going to be changing as well, because a lot of that high-risk drinking happens during orientation week, where a lot of the fraternities and sororities get together and plan a whole entire week long during orientation week, and that sets them up of the normative behavior right off the bat. So definitely appreciate that, and we'll see what happens. There is going to be, I have heard, changes in the alcohol policy. We'll see where that goes and what we need to do from a prevention standpoint to help there. Would love to get your feedback whenever that is announced of what we can do on those regards as well.
So Amir, you teach freshmen. What are your impressions?
Yes. Okay, let me see if I'm not connected. Can I hear me? Can you hear me? Yeah, that was a great presentation, Justin. Thank you so much. And I want to emphasize what you said about that comment about the Duke culture. Every year I ask my students, why did you choose Duke? And most of them, they say the same thing. They say, work hard, party hard. And actually, I had several years ago, I had a student who had been accepted to Harvard. And I said, why did you choose Duke versus Harvard? And he immediately said, work hard, party hard. So this is, the Duke has been known for that.
Interesting. So I have a question for Chris. The marijuana, cannabis, kind of loosening of the restrictions is going on nationwide, but in some states it's really been in place for quite some time. So what is the experience at colleges and universities in states there where there's open recreational use of marijuana? Is that correspond to any increase in use patterns at the colleges or not?
Yes, we have seen. Am I off mute? Yeah. So I live in Washington State, and we legalized recreational use of cannabis 4 years ago, maybe. And so we found an immediate uptick in the percentage of people that have, the percentage of students that have tried marijuana, and a slight uptake in the more frequent users.
Mm-hmm.
But more so, it's been more people are dabbling than really increased use across the board. But yeah, we have seen an uptick for sure.
Okay, but you don't see an increase in problem use or daily use, that sort of thing?
I'd have to look at it in more detail. It hasn't come across my radar. I think that more and more universities are trying to address cannabis use because of the new laws. But I don't have that information right in front of me as far as the increased use.
Okay.
I would just make the observation there that in terms of it doesn't matter what state you live in, given the internet, it is readily available anywhere you happen to live, and what we're seeing clinically is a concerning uptick in the concentration of THC in dabs and stuff like that. And I'm treating 2 students who have that really upsetting syndrome called cannabis hypermenesis, where they can't stop throwing up. One student was 6'3" and weighed 115 pounds when I met him. Of course, we immediately got him to a physician. Other one was not quite that thin, but was dangerously thin. So it's here, and it's nothing like alcohol in terms of quantity, but it's still a concern, and it's perceived as an innocent drug, and it's not.
Yeah. Okay. Other comments? I also had a question about the interactions of Duke and Durham. And you mentioned that some of the fraternities and sororities were disaffiliating either by choice or by edict from Duke from a relationship with Duke, and then continuing to, conduct their parties, but off campus. So is there some outreach between Duke and Durham to try to address the students who are, maybe getting too intoxicated off campus?
Yeah. So historically, the Dean of Students office, Clay Adams, if you're familiar with that name, it has been the liaison between the neighborhood associations, primarily where there's large concentrations of students in. That is my next kind of pivotal point of where, now that I am unable to deliver prevention education to these off-campus organizations, coming at it from a good neighbor initiative. And I know, Jeffrey, you mentioned kind of UNC, they have a really good neighbor initiative over there that we're trying to adopt, where we can go at it from the environment and culture of the source and the access of the alcohol with those individuals. We have seen an increase, not from Durham PD, but alcohol law enforcement this year. So I think, in my anecdotal kind of observation, I think there is a new ALE officer that is overseeing our area, to where there's an increase in enforcement. And I have talked to them and applauded them for their efforts. I think over the past weekend, there was an article in WRAL. I think they gave out over 300 citations in like Chapel Hill, Orange, in Durham, primarily targeting shooters. And then we're seeing the behavior on that end, where there's assault of government officers and just some different behavior that we're getting access to now. But to your question, Ed, trying to go at it as a good neighbor initiative. So those are all things that we're trying to do. With COVID, it definitely increased a lot, because a lot of the neighborhood associations were calling the Dean of Students office to let them know that students were partying. And that's how we were able to figure out how widespread this activity and kind of this culture is. So a couple of touch points that we're seeing there.
Yeah. And then in terms of the interventions or outreach, I assume that you're also involved in kind of peer-to-peer relationships and social media, and often that may be more effective than to have us older folks tell them don't do this or don't do that. So what are your efforts in the kind of peer counseling sort of area?
Yeah. So we run a program that used to be called Party Monitor Training. We have since changed the name to Social Host, which is an active bystander intervention training that students and student groups are required to go through if they are planning on having a party on campus that involves alcohol. Prior to the mass exodus of our fraternities and sororities, we typically trained about 700 to 800 students a year on that. We're right now a little over 200 for the fall semester. So that's the peer-to-peer piece that we have. We do have a set of undergraduate interns, not as many as we've had in the past, that act in the capacity of peer health educators and help us develop and disseminate information via social media, and infiltrating certain groups with high-risk behaviors. Those primarily being our Greek-affiliated groups and selective living groups on campus.
Okay, well, I wanted to thank both of you for the great presentation and great work that you're doing. And we're here to help if you need any consultation or referrals or something. Feel free to reach out. So I wanted to remind people, next week we have Alex Marshall from NC Central University talking about alcohol and more kind of basic translational research. And then also I forgot to mention tomorrow, the Psychiatry Grand Rounds, Joseph Lee is going to be speaking. He's from Hazelton Betty Ford Foundation on a primer of substance abuse disorders in youth and families. And then coming up on the Psychiatry Grand Rounds on the 18th of this month is the TK Lee lecture. And this is Inequities in Addiction Treatment for Racial and Ethnic Minority Populations. IA Jordan from the Yale School of Medicine is going to speak. So you can go to the psychiatry website and they'll have the link information for those. So thanks again, Justin and Chris, and for your presentations, and everybody have a great day. Thanks.
Thanks so much. Thanks for having us.
Thank you.
Thanks. Bye.
Bye.